throughout the 90s and 2000s, we tried to use computer navigation to put the parts in a better spot. However, this was very cumbersome. We had to have a lot of equipment in the operating room. We had to put pins in the patient's legs so we could tell where the leg was. We had to put outriggers on our instruments so the computer could tell where our instruments were. It was very cumbersome, and there's not a lot of evidence that it really helped anything. What we're doing now with this implant is not only getting all that navigation out of the operating room and doing it preoperatively, but we're also designing that implant to fit the patient. Whereas even with all the old navigation technology, we had to use basically off-the-shelf implants. One of the questions I get from surgeons is, how is the alignment determined? With off-the-shelf implants, we have to use intramedullary alignment guides, which means putting a rod into the bones. And while that's fairly accurate, it doesn't normally replicate the knee exactly right because we're working on the angle of the bones. What we do with Conformis is we actually get a CT scan of both the hip and the ankle, and we determine what's called mechanical axis. So what we'd really like to have is that the hip, the knee, and the ankle are all in perfect straight alignment, even though the bones themselves have some angle to them. So by getting a CT scan of all three joints, we can ensure that we're in neutral mechanical alignment, which is not something that's possible with normal off-the-shelf implants.
I was navigating my knees prior to starting to do the Conformis, and so because I trusted but wanted to verify, the first couple knees that I did with Conformis, I did use my computer navigation. After doing the first 10 knees, I realized that the engineers were pretty smart and that the cuts that they said I was going to get were the cuts that I got, and I recorded all those with my computer navigation. After we did 10, a paper came out on the Visionaire knee that was in the Journal of Arthroplasty talking about how many outliers there were with using an MRI-based cutting system. And because of that, and because I felt the CT-based cutting system in my experience was so much better, I went ahead and brought that out to the next 35 patients. So we did 35 consecutive patients where we did computer navigation on the pre-navigated cutting blocks. And I checked the original alignment, I checked the cuts, and I checked the final alignment of all these patients. So at 35, we had no outliers. We had 30 that had perfect neutral alignment, and then we had 4 that were within 1 degree of perfect neutral alignment. And so I was quite satisfied with that. I went ahead and made an abstract and sent it down to the CHAOS meeting, which is a computer-assisted orthopedic surgery meeting that was in Orlando this last year. And they accepted it, and I gave a podium presentation. It was well received by the participants down there. And because of that, and because of the fact that the Visionaire study had about 60 patients in it, we decided to go ahead and do this out to the 65 patients that we did. We're now at 65 patients, and in that 65 patients, I only have 7 of those patients that don't have perfect alignment. They're within 1 degree, though, of perfect alignment, which is wholly acceptable in anybody's hands. And so it's been really groundbreaking in that we've shown, I think, in this paper that the computer navigation, the pre-navigated cutting blocks really are and do make the cuts that they're supposed to.